Good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Tonight, I am talking about fighters and footballers' role of volumetric MRI. In thinking about this, I was trying to relay my point, and hopefully the point will come across. If you have a family history of heart disease, you're probably going to see your doctor every year, and they're going to do tests like checking your cholesterol. You may see a cardiologist, and they may do an echocardiogram or an EKG. And there's going to be this yearly supervision of an individual, most typically in the medical setting, trying to do everything possible to prevent what may be a heritable disease or a disease that may come on because of previous lifestyle factors. I don't feel that we're doing that in the arena of brain injury. We've evolved so much in the last 20 years. We've learned a great deal about brain injury, the devastating consequences of subconcussive head impacts, and new and really cool neuroimaging strategies for assessing the brain, for assessing damage to different areas of the brain. Unfortunately, I don't feel that this has distilled out there to the public. I feel that it's not being employed by maybe healthcare practitioners in the way it should be. And I'm talking about this to see if maybe we can create some more awareness about this issue. I don't have my disclaimer here, but just to note it, none of this is intended as medical advice. Consult with your doctor. These are just thoughts, topics for you to ponder and go over with your doctor or healthcare practitioner. So this is an article I referenced last week. Great article from Neurotrauma Reports, relatively recent, 2021. Really cool because they looked at boxers and MMA fighters, and they looked at their weights and the effects of how many fights they've had on their brain volume, as well as what weight class they're in, and maybe does strike force have some potential in increasing damage to the brain. So they studied all these different factors like weight cutting, probable force with the punches, so to speak, or the kicks, and then also neuropsychiatric testing. Great article. I'll probably keep going through it. There's many nuances to it. And in thinking about tonight's discussion, I was then going back to an article I read a few years ago. This is out of Brain Imaging Behavior 2019, really came on the scene in 2020. And it's called limbic system structure volumes and associated neurocognitive functioning in former NFL players. So your limbic system is in the middle of your brain, and it's your emotional processing area. So the common thread is that we're dealing with football players, fighters, which could encompass MMA as well as boxing. And the common thread is and are subconcussive head impacts and or concussions. And probably the main concern for a lot of those who are involved in these types of sports activities are what is going to happen to my brain down the line. And maybe that is not a concern, but maybe that should be more of a concern for the healthcare community who is managing or should be managing these individuals. In my opinion, probably at least on a yearly basis, makes sense to me. But what can we be doing based on what we know? Of course, chronic traumatic encephalopathy is still a post-mortem diagnosis. So you're not going to get that diagnosis until an individual has passed away. I don't have the current exact number that of autopsies that Ann McKee has done on former football players, but last time I heard it was like 110 out of 111 autopsies she found to have signs of chronic traumatic encephalopathy. We've seen signs of CTE even in football players from high school. So high school football players, not all of them at that rate, but I think it was like 3 out of 8 at one point had signs of it. We're seeing it in college football players. So when we look back at, this study, looking at fighters, one of the main questions that comes to mind, well, are these fighters going to be predisposed to CTE? Is that something they're thinking about? Is it something their doctors are thinking about? In my opinion, it's something certainly the neuroscience and neurology community should be thinking about. So that article I just cited from 2019 about the limbic system, in essence, what they found is that they found selective atrophy throughout the limbic system. Your limbic system is this yellow area that's the cingulate gyrus connecting into other parts of the medial temporal lobe, like the hippocampus and the amygdala. There are other structures within the limbic system, but these are some of the biggies. And they found in these football players, compared to normal controls, that they saw declines in certain neuropsychological tests correlating with what we would expect with CTE. And then they also saw atrophy selectively in this area of the brain as compared to normal controls. Many of you may not know that we can do MRI scans that actually give us a metric, a score for a density of different areas of the brain, which is really cool. And we can compare an individual to age-matched normals. So this area of your brain, you see this big white structure here, it's whiter, that's the corpus callosum. The corpus callosum connects both hemispheres together. It's the main white matter tract of the supratentorium, this area which encompasses most of what you consider your brain. So what we find is that around this white matter tract, it would make sense because there's a lot of shearing and torsional injuries to the brain during TBI and subconcussive head impacts, that it would be the area immediately around the corpus callosum that could be taking the brunt of the damage and may have more atrophy. When we're talking about head injuries and neurodegeneration, we have to consider that head injuries by themselves can predispose someone to Alzheimer's disease. Head injuries certainly can predispose to chronic traumatic encephalopathy. From a neuropathology perspective, meaning i.e. what Dr. Ann McKee does, where she goes in and she looks at brains under a microscope, Dr. Omalu was really the one that put this on the map, is that they are looking at brain structure, they're looking at accumulations of abnormal proteins like tau and beta amyloid, if we're talking more about Alzheimer's. And in essence, they can distinguish certain patterns of these protein depositions throughout the brain and differentiate whether it's Alzheimer's disease, it's an Alzheimer's disease-like process versus chronic traumatic encephalopathy. So they can make that distinction. But for the individual who's been involved in contact sports, I think it's good to know that we now have brain scans that can tell us if there's atrophy. They may not be able to exactly validate if someone has CTE, but we are seeing findings that are kind of like a smoking gun that may indicate a pattern of atrophy, possibly consistent with what could become that, or a pattern of atrophy associated with head injury. We don't even have to call it CTE. A pattern of atrophy associated with head injury that we should be concerned about. And then what can we do to ideally help this individual who's sitting in front of us, who has been a boxer, who's been in the MMA world, who's been a high school, college, or professional football player? What can we do? And that's where you can go in and watch my concussion playlist. And I'm kind of back on this topic, so maybe I can give you some more details of maybe the things that we can all be looking at metabolically. And we don't know. We don't know for sure that any of this has some type of long-term impact because all of this is so new. But we do know that inflammation in the body may promote further inflammation in the brain, as an example. We know that the repetitive head injuries seem to promote inflammation in the brain. So inflammation seems like a likely target that maybe we can be thinking about. And there are other options throughout the literature that have been shown to promote neurogenesis in certain areas. So those are topics for consideration. I hope this fuels some thought. I hope it's somewhat helpful. And if you have any questions, post them on the comments. I'm not great at responding to comments, but I will try to observe them and get back to you in some type of format, whether making another video or if I can. All right. Have a good night, everyone.